Look younger, feel better. Medical Spa of Midland.
Welcome to Medical Spa of Midland. Today we'll be talking about hair removal. The main cycle that we're looking to catch the hair growth in is called the Anagen Phase. And this is actually when the hair is connected to the papilla or the bulb. This is where the actual hair growth begins. So this is the main phase we're looking for. The hair grows in many different phases, and the laser won't work with those specific follicles or hairs that aren't connected to the papilla. So we need this hair to actually be in this Anagen phase. So each individual treatment is spaced out accordingly to the area, meaning if the individual wants to do their face, they will come in every 4 to 6 weeks. Underarms to the bikini line, they'll come every 6 to 8 weeks. And the legs will be every 8 to 12 weeks. And those are specifically when we'll catch specific hairs in this Anagen phase. What the laser conducts to is melanin, or meaning coloration. The more melanin in the hair, the better conductivity we'll have with the laser, and they'll get a better result, meaning black hairs are wonderful, dark brown, light browns. But when you start going into your grays, your whites, your reds, your blondes, the laser doesn't affect these. And with this specific laser, we need the area shaven. It needs to be shaven close to the skin. Some lasers require stubble, but this one requires it to be shaven. The laser will specifically conduct to the coloration in the hair. So when it's, let's say we apply the laser to one specific spot, what it's going to do is send little tiny laser beams down each little follicle. The ones that are connected in that Anagen phase, it'll actually burst that bulb and those hairs won't come back. The ones that aren't connected, that have grown away from that papilla, they won't have any result at all. It'll just travel the length of the hair and bounce out. For the hair reduction, we have two specific lasers. The first one being our MediaStar 810. This laser is specifically for skin types 1, 2, and 3, meaning your lighter skin to medium skin types. Our Gemini, which is a 1064, this is specifically for 4s and 5s. So we can actually treat any type of skin type in our facility from 1 to 5, meaning from the lightest to the darkest, which nobody else can do. Most of the time for a female, you can expect to do at least 5 treatments. Occasionally you'll do 1 or 2 more. For a gentleman, you're looking at anywhere from 6 to 10 treatments, depending on what area you're treating, due to the fact that a male will produce a little bit more testosterone and the hair will grow quite a bit more. So it takes a little bit longer for a male to do the treatments themselves. It is an 80% permanent reduction. There's no such thing as an 100% permanent reduction. With this 80%, what you're looking to see is once you're done with the treatments, you'll have 1 hair here, 1 hair there, very fine, very sporadic, and they'll grow very, very slow. You will have to do a maintenance maybe once a year, maybe once every 2 years, just depending on the individual themselves. So there's no such thing as a permanent, 100% permanent reduction. There's a slight discomfort, but we do well in controlling with pain control, meaning the individual will take home some numbing cream and put it on an hour before they come and see us. And likewise, they can take some Tylenol to take the edge off before. And when they get here, we'll apply ice to the area before we treat it. And likewise, the handpiece, it has a cooling mechanism on it that helps guard from discomfort. But truly what I find was, with all my experience and all the years of doing these treatments, what I see is the individual feels a little bit of a poke, nothing extreme, nothing where it's not tolerable. But the coarser the hair, the more you feel. But we do well with controlling the pain. So it's not anything that you will walk out screaming or anything like that. It's tolerable. Side effects would be a little bit of redness maybe when you leave here, which would alleviate within 2 to 24 hours. Maybe a little tiny bit of soreness around the hair follicle if those hairs are coarse. Or you can have something that's called follicular edema. Looks like a little halo around the little hair follicle, which is just swelling of the follicle from inflammation from the treatment itself. And that'll alleviate within 2 to 24 hours itself likewise. Make sure that the hair is shaven closely to the skin. You do that the night before. Make sure you put your numbing cream on an hour before you do the treatment. If you've been exposed to long-term sun, you need to make sure and talk to your technician before we even do the treatment itself for your safety. That's it. Post-procedure is really protecting yourself from the sun. There's no real downtime from the treatment itself. That redness that will occur 2 to 24 hours. Besides that, really protecting yourself from the sun is the main thing for a couple of weeks. Even before the treatment itself, you don't want to come in tanned and so forth, because the laser itself will conduct to your skin also. So be sure and protect yourself from the sun. Sunscreen, sunscreen, sunscreen.